Manchester has gained national attention for its Safe Station program, which turns fire stations into a point of first contact for people seeking help in their struggle with addiction. But the recent collapse of the nonprofit where the Safe Station walk-ins were taken is prompting an overhaul of the program. Here this morning to discuss our Manchester Mayor Joyce Craig. Thank you for joining us, Madam Mayor.
Thank you.
And Manchester Fire Chief Dan Goonan. Almost shifted you over to a department there. Thank you for joining us. Mayor Craig, let's rewind a bit first. What happened to Serenity Place under that first iteration of Safe Station?
Sure. Well, obviously, Serenity Place is no more. They had financial issues and an awful lot of people coming in, and I believe were overwhelmed. So what we did was we took a look at what was going on and identified gaps and opportunities, and have set up a new, more streamlined, effective process for people who are coming into fire stations and needing help.
Before we get to that process, Chief Goonan, was there any indication that something was going wrong, or did this kind of fall apart pretty suddenly on the back end of the program?
Yeah, it happened pretty suddenly. You know, I had an inclination that, you know, we were starting to overwhelm that agency. We sent well over 2,000 people their way. They had a lot of other programs going, so I think they just got overwhelmed. You know, they were really, you know, as things went on, you could tell they were trying to prevent harm. They were shooting from the heart. They're very compassionate, dedicated professionals, and I think that's just what it was. It was just overwhelmed, and there's no one agency can do this thing by themselves. We learned that.
And Mayor Craig, was there ever a chance in this transition period here that Safe Station wasn't going to survive, that you weren't going to be able to find the people to put it together and make it work?
Absolutely not, and that was the encouraging thing. We had support from Concord, from the governor, and entities from around the community who came to the table. You know, treatment facilities, the hospitals, everyone in this community wanted Safe Station to survive, and provided us the support that allowed us to put this new process in place.
So explain what's different now when someone walks in that fire station door.
Sure. So someone walks into the fire station door, the fire department does what they've always done in terms of a medical check. Depending on what comes of that, they'll either go to a hospital if they need further support there, or they'll go over to Granite Pathways, where right now they're located in the former police station. We'll be moving shortly. But from there, they'll get a screening, and they'll identify the need of that person. So one of the things that we found through the process with Serenity Place is that people weren't always going for substance use disorder. They needed shelter, they needed food, they had mental health issues. So during that process at Granite Pathways now, they're really identifying the needs and directing those people to where they need to be. We're calling in Manchester Mental Health if we need to. We're getting people to New Horizons or to the support that they need for substance use disorder. And then Farnham Center has joined us as well in terms of helping with the in and out patient services.
But it's key to note, if someone comes in the door and has entered treatment before, you're going to encourage them to seek out that treatment provider again. How does that conversation go, Chief?
So what we're encouraging people to do, and like I said, the fire stations are always open. And one of the things when the Safe Station program started was to capture that moment that someone feels that they can go into treatment or they access services. So what we provided was that easy access point. And that was, I think, really important, and that was really what we wanted to do. Now when people come in, it's more of a kind of a comprehensive community effort. Everybody stepped up. When they come through our doors, when we bring them next door to Granite Pathways, like the mayor said, there's an assessment done, and they're quickly taken from that point to an assessment, a clinical assessment with Farnham Center, and we can get them, I think, in to the right place at the right time a lot quicker than before.
And Madam Mayor, it seems like, you know, as this has moved along here, the firefighters have done such a great job in stepping up, and people trust them, and that's kind of part of why this works. But maybe, is it a social worker now who has to meet them at the door or something like that? Because it seems like these guys are actually kind of moving into that role of social work.
Well, right. So what Safe Station did, as Chief Goonan said, is provided an access point for people to go when they knew no other option. So they were desperate for help, and they opened up their doors. So now, you know, what we're also doing in this effort is educating people on other options. So there are other access points within the state and within the city, and people need to understand that. You know, Farnham Center has open access. There's a toll-free number in the state that people can call for help in their area. and the fire stations are still available. There are safe stations in Nashua and other places as well. So, you know, at the point in time when Safe Station opened, that was really the only place that we had available. But now there are other access points, and we're providing education and opportunities for those people to access those, and then the treatment on the other side as well.
If that person who has been in treatment before shows up and you're encouraging them to seek out their former provider, is that a okay, move along, or do they get to go someplace that day or night?
Well, we would encourage them to go to their former provider, but if they, you know, aren't able to access that or it's closed, we certainly will help people that are coming to our door.
And Manchester shouldered such a tremendous burden here for the entire state, and actually people coming from around the country. It seemed like we had, I think, remember someone from Ohio had showed up at some point.
Yeah, all over the country.
And so, and that's perhaps part of the reason why this became sort of too big for one nonprofit to handle. Is the state's commitment financially to this program enough? Because Manchester obviously can't pay for the state's problems by itself. Is the state doing enough, Madam Mayor?
From a financial perspective, we need more help from the state, absolutely. If we're going to continue to provide services to people throughout the state, we will need some help financially.
Chief, how many people do you see on a daily basis that are coming from outside of Manchester?
When we track it, it's about 65%. That is, I think what happened, we made it really easy for people to walk into the fire station. We made it, you know, I think what happened was they weren't, you know, when they were in maybe that contemplation mode, when they were trying to, you know, think about accessing services, the fire station was there. It was an easy access point. Instead of picking up the phone, maybe calling that 800 number, there's other access points all over the state that people I don't think they were, you know, trying to do that. You know, we're just encouraging people to take that other kind of road. If they need it at that point, certainly they can come to the firehouse here or in Nashua. We don't turn anybody away. That's not our business. We help anybody who comes to the door for anything. So it's just getting that, you know, the word out there that there's other places to go.
And it's educating other hospitals and providers and fire stations and police stations throughout the state as well. So, you know, when we looked at what was happening with Serenity Place, we can see where and how people from out of town were getting referred to our fire stations. And now there's an active effort to reach out to those entities and to educate them on, you know, what's happening in Manchester and what's available in their communities.
And we see in Washington, this budget deal that's being hammered out potentially has $6 billion for the opioid epidemic to fight it. Obviously, the funding formula is a key part of that for New Hampshire. But if a wave of money that is significant comes in here, Mayor Craig, what would you want to see that funding go toward in Manchester?
In Manchester, we need to look at the whole process. So education, prevention, treatment, and recovery. And, you know, when we're talking recovery, it goes beyond just the recovery in a treatment center, but making sure that, you know, people have the place to go and live, have opportunities for jobs. So it's the full scope of, you know, what happens when they're done with a 30-day, 60-day treatment.
Yep.
And Chief, with this perhaps 10, 20 years from now, you know, hopefully, knock on wood, as we've moved out of this crisis, do you still see Safe Station being a fire station-oriented program where you guys are that first point of contact, or should this evolve beyond that and sort of get you back to your original mission?
Right. I think, you know, tell you the truth, I think this is part of our mission, just helping people. I think it's a good access point. It's a place in everybody's neighborhood, especially in Manchester. You can walk in anytime for really any problem. You know, we really are, you know, we're an all hazards organization. When this thing came out, we treated it as a crisis. So that's why we opened our doors up. We knew we had to do something, and that was our, you know, kind of our simple mission to say, okay, we're here to help. We're the fire department. It's easy to come in. I think people are comfortable with us. There's really no stigma, and I think one of the things our guys did so great is there's just a handshake, and no one's judging you when you come through the door. So it made it really comfortable for people to come in. So as far as our mission goes in the future, this is always going to be our mission, and it always has been.
All right. And Mayor Craig, we know you have a number here that we wrote down to make sure in case anyone does need help, they can call
1-844-711-HELP.
All right, 1-844-711-HELP. Mayor Craig and Chief Goonan, thanks for your help, and thanks for your time here today and the help you've given to all of the people in Manchester through Safe Stations. Well, thank you for your time.
Thank you.
All right.